Hello people, in this video let us look at blood transfusion. They will ask this on the exam for you in medicine. So blood transfusion, basically we look at everything about it. We look at blood donation and then how it is transfused to the patient. Both of it we'll look. Now let's start with blood donation. Okay, we'll first collect the blood. Okay, how to collect the blood. So you'll have to do a venesection. It will take around 10 minutes to collect around 400 ml of blood. Okay, and then you can also do an apheresis if you want to collect platelet, but that will take 2 hours and you'll have to puncture both hands. Okay, so basically if you're collecting platelets, only platelets from a person, it will take a lot of time and you have to do 2 punctures, and then you should have this apheresis machine also. Okay, so anyways, here they are showing you a simple venesection and they are drawing the blood. Only 10 minutes procedure. After that they'll keep the person for around 10 minutes observation and then they'll send them home. So they may collect blood even in these vacutainers based on what tests they want to run on this blood, and they'll also may take the blood for donation in this bag. Okay, so they may take it in this vacutainer for testing. So what they will check the blood group. The blood group can be A, B, O, AB or Bombay type, where there is no antigen at all, okay, on the RBC surface. Okay, this is about the blood group antigen we are talking about. Then there is something called as RH antigen, that is rhesus antigen, that can be there or may not be there. So it will be a positive or a negative. Okay. So look at the blood group. You have so many blood groups. O positive is very common and AB negative is very rare. Okay, AB negative is very rare. Who is the universal donor? It is O negative. Okay, O negative is the universal donor. However, this O negative cannot give even to Bombay blood group. Okay, but cannot give to Bombay blood group. Bombay blood group is nothing but HH group. Okay, we'll come to this. So there is something called as Bombay blood group, HH. This does not have any antigen on the RBC. The blood group antigen is not there. So you can see there is no agglutination for AB. Okay, and anti-H also there is no agglutination because H antigen also is not there. Okay, H antigen was there on what? On O. Even that H antigen is not there on this Bombay blood group. So this Bombay blood group is very different from that O also. Okay, so did you understand? So Bombay blood group cannot receive blood even from O negative guy. Okay, so now you have donated blood and you have gone home. Now what and all is happening? They have checked your blood group, blood type and all that, RH type, everything they have checked. Okay, now further, how are they going to give it to the patient? Before that, how are they going to store it? Okay, how are they going to process your blood? Okay, so what did they do? They are taking the blood into that bag, right? That bag has preservative. Already that bag will be there, right? That blood containing bag that will already have preservative. Okay, the preservative can be this saline adenine glucose mannitol, SAGM. Okay, what is the preservative? Saline adenine glucose mannitol. Say saline. You should say, otherwise you will not write in the exam. Saline adenine glucose mannitol. Can you imagine there is glucose that they are adding to the blood that you are donating, and saline and then adenine and mannitol. Mannitol actually is a diuretic, right? Anyways, now citrate they are not using, okay, anymore. If they add citrate, what will happen? Hypocalcemia used to happen. Okay, leads to hypocalcemia. Anyways, we are not using that, so we'll leave that. Now that you have donated the blood, now what? How are they going to process it? Right? We already told you that. They will check it for the blood group, right? They will check whether it is A, B, AB, O or Bombay blood group, etc. I'm not sure if they check for Bombay blood group, and then they can check for RH positive, RH negative, they will check for. Okay, and then what they will check for? They will check it for diseases. What diseases will they check it for? They will check it for HIV, hepatitis, syphilis and local diseases, whatever they are scared of. That also they can check. Okay, like malaria, Chagas disease, etc. and all they can check for. Okay, based on their need they will check. So now let us say everything you have passed. Okay, your blood doesn't have any alcohol, anything. Even alcohol they should check, right? Yeah, they check for all that. Okay, now what they are doing, now the tests you have passed. Okay, now what they will do, they will take this blood bag and process the blood into blood components. What are they doing? They are processing this blood into blood components. Okay, how will they do that? They will centrifuge. They will remove WBCs and throw them. WBCs are not at all used because WBCs cause febrile reaction. So you can see here WBCs cause febrile reaction we have written. So remove WBC. What else you have? You have RBC, then you have the plasma, and then you have the platelets. Okay, you're separating all this. Okay, platelets. So 3 things you got. What and all you got? RBC, plasma, platelets. So basically what is plasma? See, when you take blood, okay, whole blood, and then you separate, you just let it stand. If you let it stand, what will happen? It will, all the cells will settle down, and whatever you're left with on top is plasma. So all these are cells, formed elements, okay. This will have RBC, WBC, and platelet, okay. RBC, WBC, and platelets, okay, will be there. And on top you will be left with serum with clotting factors. So this will have antibodies. What does this have? Antibodies. Okay. So serum will have antibodies. Remember, serum will have antibodies, vitamins, all that will be there in your serum. So this serum, focus guys, plasma is nothing but serum plus clotting factors. So if you remove clotting factors from plasma, you'll be left with serum. Serum has what? All these antibodies, vitamins, etc. you can say. Okay. Did you understand? It's so complicated. So basically there are so many, what do you say? Things in blood. Okay, so you're just separating what and all have you taken here. You've taken the red blood cells. Red blood cells you have collected in one bag. WBCs you have thrown out, and then platelets are here. Remaining whatever is plasma. Okay, plasma. So they are calling this as fresh frozen plasma. That is suddenly, immediately, if you are using. Immediately, if you will take this and use this, it is fresh frozen plasma. Fresh frozen plasma will have what? It will have clotting factors like 8, 9, 1 Willebrand factor, that and all. So, fresh frozen plasma is fresh. Understand, it is fresh, okay? It will have all the clotting factors like 8, 9, 1 Willebrand factor, all this it will have, okay? So, basically, did you understand? 8 is what? Anti-hemophilic factor. 9 is anti-Christmas disease factor. Then the 1 Willebrand factor is what? 1 Willebrand factor is going to carry factor 8. So that is why 1 Willebrand also is important. Okay, so that is fresh frozen plasma. Then here you have the platelets, right? Platelets. The platelets you have given is here. Sometimes only platelets they can collect directly from the patient, that they have shown here. Donor can directly donate only platelets. That is plasma apheresis, but that you have to make, you need a apheresis machine, and then you will have to you'll have to puncture in 2 places for that guy, right? Both the arms they'll have to use, okay. So for plasma apheresis. Now let us come here. So here you have, guys, where are we? Do you know where we are? We have separated them, okay. We have separated the blood that you gave into red cells, platelets, and fresh frozen plasma. When you gave the blood itself, that bag, will have a quadruple bag or something. Like there'll be so many bags in that. Then they will centrifuge, okay, like this. They'll centrifuge, and then they will use some machine which actually separates the levels. It will separate the contents into each of these bags, okay. So that is what they have shown here. When they have shown 4 bags here, that's what they are showing, okay. Then they will centrifuge, and then they'll use some machine and then separate. Okay, so the RBCs are here, fresh frozen plasma and platelets. Okay, so did you understand? So WBCs they are not using. RBCs they will give if there's anemia, etc. And if person has okay, anemia, you can give this. Basically, what will happen? This only RBC, the cells you are giving, right? So they will not have volume overload. Okay. So it is safe. The volume overload won't be there, and they won't have adverse reactions because of these platelets or WBCs, etc. Now, yeah. So this you can give. Now coming to fresh frozen plasma. When will you use fresh frozen plasma? If the prothrombin time or APTT, that is activated partial thromboplastin time. Now, if that is more, that is the person is taking more time for blood to clot, right? That's what it means. So coagulation is taking time. So that time, what is thing? This person has a bleeding disorder. When the person has a bleeding disorder, you will give what? Fresh frozen plasma. What will you give? Fresh frozen plasma. Okay, otherwise what you can do, you can from this fresh frozen plasma, you can prepare something called as a cryoprecipitate, okay? And you can keep it minus 30 degrees they are talking about, cryoprecipitate. Now cryoprecipitate is coming from this plasma. So this cryoprecipitate you can give if a person, if the fibrinogen level is very low, okay? If fibrinogen level is very low, they'll give cryoprecipitate, okay? So if a person has disseminated intravascular coagulation, he's coagulating and he has lost all the clotting factors and he has lost the fibrinogen, it's no fibrinogen left, what will you give that guy? Cryoprecipitate. Very good. Okay. So now let us go here. Here they are talking about how to store platelets. You can look at that, and you can give platelets if the person wants platelets. Like in dengue and all, no, sometimes dengue shock syndrome and all, they might need platelets, right? If the platelets level go very low. Now you can see here this patient is going to receive whatever blood product he needs. Okay, so here you can see this is the patient, but before giving to the patient, you must do cross matching. Okay, now all that we will come to later. Okay, giving to the patient. Now first of all, your blood has been separated and now they have kept it here in this fridge and all that, wherever they need to keep how much of a temperature that they will keep. Okay, so what and all you have collected, you have separate things. Now you have red blood cells, you have fresh frozen plasma, you have platelets, and then you also have something called as cryoprecipitate. Correct? So 4 things you have. Now under this plasma itself, from plasma itself, you can have so many blood products like coagulation factor, like we told you, 8, 9, Wald Miliband factor, etc. Then immunoglobulins, antibodies will be there. That is why, they don't want to give all this at all. They just want to give RBCs to some people. They don't want to give this plasma and all. It will have antibodies, right? So that's why they're talking about that. What and all plasma will have? Coagulation factors, immunoglobulins, like antibodies it will have, and human albumin also it can have. Okay, so that is what you should understand. So here you can see blood has plasma and these formed elements in which you have platelets, WBCs and RBC. Now coming to plasma, plasma will have what? Plasma is serum plus clotting factors, correct? Serum plus clotting factors is plasma. Now this plasma has what and all? It has proteins, water, etc. And in the proteins you have albumin. So that's what they told you. You can get human albumin also from plasma, right? Fibrinogen you can get from plasma. What else they were telling about? Clotting factors, right? Clotting factors also you can get from plasma. Like clotting factor 8, 9, Von Willebrand factor. And then you can get a lot of antibodies, globulins. So that globulins they have written here, immunoglobulins, right? All this you will find in plasma. So understood all the blood components, blood products, everything you have understood. Now let us go to the section where we are going to give the blood to the patient, okay? Now, what will you do before giving the blood to the patient? Will you just go, now that from the fridge you will take and give it? No. You have to check whether it is compatible with the patient. Okay, so you will have to see who can give to whom and all that. So A can receive from A and O, B can receive from B and O, AB can receive from AB, A, B and O, O can receive from O. Okay, but Bombay blood group has to receive from Bombay blood group, and positive can receive from negative, but negative can receive only from negative. Okay, that is why O negative is the universal donor, but still this guy cannot donate to Bombay blood group guy. Okay. So there is something here called as cross matching. Okay, so you will take the donor's blood. This is the blood that you have, and then you will take the recipient's serum. Okay, recipient serum you will take, and then you will mix these two, and then you will check the reaction. Okay, so you have to check whether it's agglutinating or not. Very important. If it is agglutinating, then you cannot give this blood. So basically, you're going to take the correct blood group, and then you're going to run something like a cross match. Okay, so what is this cross match? So you're going to take the donor's RBC with the recipient's serum. So see here, you're taking the donor's RBC and you're taking the recipient's serum and mixing it and leaving it, and then you are adding this anti-human globulin reagent, and then if there is agglutination, it is incompatible. If there is no agglutination, it is compatible, so you can take this. Okay, this is major cross match. There is one more thing called as minor cross match. Okay, just look at that. We have written it here. If you remember major, you may be able to arrive at minor. But instead of serum, they are taking plasma. Okay, so now you know plasma means it will have serum plus clotting factors. Okay, so this is about the blood. Then you will give the patient the blood. So you will give the patient blood. You will keep monitoring the vitals, etc. And you should know the complications of blood transfusion. Okay, there are 3 headings here: immune, infectious, and massive blood transfusion complications. We'll come to that. First, look at immune. Under immune, you have hemolytic and non-hemolytic. Hemolytic means the RBCs are rupturing. So this can happen because of major ABO incompatibility. Imagine you have given the wrong group itself. You have not done RH typing, everything you have given wrong. The RBCs are just rupturing. So here what will happen, there will be intravascular hemolysis, that is within the blood vessel there is hemolysis. So that person will have blood in the urine, he'll have pain in the loins, he'll have kidney failure, he'll have fevers with chills and rigors, okay. Then minor incompatibility. Guys, are you focusing? Major incompatibility, ABO blood group itself a mismatch, okay, that is over. Maybe they really gave the wrong blood group. Now coming to minor, The antibodies are the problem. Okay, and here there will be extravascular hemolysis outside of the blood vessel, and these people can have malaise, jaundice, fever, etc. The treatment is supportive. Now coming to non-hemolytic, are you able to understand, people? Blood group mismatch and all over. Now we are going to non-hemolytic. That is something, the RBCs is not rupturing as such, but some other things are going on because of this WBC platelets and all. There can be a febrile reaction. But you can understand nowadays they'll give only what the person needs. They won't give the whole blood, right? Mostly. Then they can have an allergic reaction due to plasma products, because these plasma will have antibodies, etc., etc., right? So anyways, they can have an allergic reaction. So you have to treat that with antihistamines. Then there can be a lung injury. So that is called as TRALI. What is it called as TRALI? What is TRALI? Transfusion related ALI. That is acute lung injury. Okay, TRALI. Nice word, no? To hear TRALI. So basically something to do with the lungs. Okay, the recipient's neutrophils, that is this own man's neutrophils, the recipient's neutrophils lodge in the pulmonary capillaries and release mediators that cause pulmonary capillary leakage. Okay, so that is what is this man's neutrophils are going in, sitting in his lungs. Okay, all that is because of what? All the blood transfusion we gave him, poor guy. Can we move on now? Congestive cardiac failure he can have. If you give whole blood rapidly, what will happen? Volume overload. Heart failure. Yes. So that's why you should not give whole blood. That's what we are trying to say. Now let's go to the other section here of the complications of blood transfusion. People, are you there with us? The complications. So other complications are infections. So freely you are giving this guy some infections like HIV you are giving this guy, hepatitis you are giving, syphilis you are giving, malaria you are giving to this guy. So hope you have screened for it and looked for it, and the blood is totally fine to give. Okay. Lastly, we have to look at the complications of massive blood transfusion. Now, what is massive blood transfusion? Massive blood transfusion means you're giving this guy like over 500 ml in 5 minutes, or greater than 4 RBC units in 1 hour, or some more than half the patient's blood volume in 6 hours, or that more than a whole blood volume in 24 hours. So whole blood volume is around 5 liters, right? In 24 hours if you're giving 5 liter, or in 6 hours if you're giving like more than half, that means more than 2.5 liters looks like. And then if you're giving greater than 10 units of packed cell in 24 hours. So all this will become major blood transfusion, massive blood transfusion. When will you do this? If the person is having massive bleeding, that is he's having loss of greater than 150 ml per minute with hemodynamic instability if he has, then you will do massive blood transfusion after a surgery or a trauma or a postpartum hemorrhage, etc., etc. So, complications of massive blood transfusion, it's written here. So, these people can have citrate toxicity, hypocalcemia, that is hypocalcemia they can develop. So, anyways, nowadays citrate they're not using. Thrombocytopenia, they can have low platelets. Clotting factors can become deficient in these people, and they can have acute lung injury. TRALI looks like, okay. Now, what is this clotting factor deficiency or platelet deficiency looks like? They have a lot of platelet deficiency, clotting factor deficiency. They should have even iron overload, right? Why they didn't write? Iron overload. All this can happen, right? But iron overload can happen with repeated blood transfusions also, not just massive blood transfusion which you're doing at one time. Even repeated blood transfusions can lead to iron overload, etc., right? So you'll have to treat that, okay? Now, anyways, now we'll move that to the generic blood transfusion complication. Now, DIC. DIC means what will happen? DIC means there is disseminated intravascular coagulation, right? Within the blood vessel. This is a blood vessel. In that there is blood clot. Okay, here and there is blood clot. So what will happen? These will use up all the clotting factors, the fibrinogen, etc. So these people will have no more fibrinogen left. Okay. So next, what will happen? They'll start bleeding. See, first they were clotting and then they will start bleeding because all the coagulation things are used up. So they'll start bleeding. So these people need fibrinogen, which is nothing but clotting factor 1. Okay. So give them plasma, etc. So they will get back the clotting factors. Okay, so you'll have to, whenever you're doing massive blood transfusion, you have to monitor the person's vitals, acid-base balance, hemoglobin, blood bleeding time. We told you prothrombin time, activated partial thromboplastin time, platelets. Then you will check fibrinogen level, serum calcium level. All that you have to keep checking. Okay, so basically, whenever you're doing blood transfusion, massive blood transfusion, you should activate the massive transfusion protocol, where they will give you boxes. Okay, one box after the other box, which has different things they'll give you. Initially, it looks like they're giving only RBCs and fresh frozen plasma. Then if the person is still bleeding, they will give you cryoprecipitate. Okay, and then Serious hazards of transfusion, there is a short form for it called SHOT. What is SHOT? Serious hazards of transfusion. Okay. So let us look at this. Once you are giving blood to a person, what and all, how and all the flow chart will take you. So let us look at acute transfusion reaction here. Okay. We're looking at the flow chart, guys. Focus. So acute transfusion reaction. So this person is having fever, chills, tachycardia, hyper or hypotension. This guy is having. He's collapsing, rigors, flushing, urticaria, that is a rash. Right on the skin, bone, muscle, chest and abdominal pain he's having shortness of breath, nausea, feeling of unwellness, respiratory distress. So acute transfusion reaction, all this you have to write, okay. Then what you do, you'll stop the transfusion. First stop the transfusion, they are saying. Check the vitals, that's what they are saying here. And then what will you do? You will check whether the blood is compatible. You will check the compatibility. Okay. Now then you have stopped the blood transfusion and you check the vitals anyways. Now you just check, is the reaction only fever and urticaria? They are checking, is it hemolytic or not? And they are just continuing slowly the transfusion. Okay. If it is only this fever and urticaria. No, it is more than fever and urticaria. Then they are coming here. Okay. Check, is their blood group incompatibility? Is the blood group incompatible? They have given some wrong blood. Check. Okay, if there is something more than fever and urticaria, that's what they are saying. So there is there hemoglobin in the urine. That means there is hemolysis, right? So now you will check if there is ABO compatibility. What will you do? That means you have given the wrong blood. So you have to manage it. Okay. So how will you manage? They are giving saline, IV saline. They are giving furosemide if the urine output falls, etc. Right? So they will treat DIC with appropriate blood components, that is the fibrinogen, etc. Then they're handling the incompatibility. They gave the wrong blood and they're handling it. Now, if there is they have stopped anyways. Now if there is still some severe allergic reaction, okay, if there's bronchospasm, angioedema, what will you do? Obviously, you will again discontinue transfusion and then you will give oxygen, salbutamol for bronchodilation. If there is any hypotension, you will manage with adrenaline, etc. Looks like they are managing it like anaphylaxis. They are giving adrenaline here. Focus, guys. Are you understanding? Now, they are still continuing here. Is there still problem? Is there any bacterial contamination? Then you have to obviously check blood culture and all that. And anyways, you will give antibiotics if you are suspecting an infection, oxygen, fluid support, etc. You're just managing. Now let's continue. There is still problem. There is dyspnea, hypotension. What will you do for these people? Again, you will give oxygen and furosemide. Okay. So probably there's a fluid overload for this person. Then you're giving furosemide. If there is normal CVP, what is CVP? Central venous pressure, because your blood pressure is peripheral, right? Here they're checking the central venous pressure. That means there's no volume overload. So what they are doing, they are managing this trolley, okay? That is, they are taking chest X-ray, etc. Oxygen they are giving. They are discontinuing the transfusion. They are checking if it is ARDS, then they are giving ventilation, etc. Okay? So did you understand, people? What did we look at now? So basically, is it only fever or urticaria? Then you will manage the fever and urticaria. No, it is going beyond that. If there is ABO incompatibility, hemoglobin urea, that means there is blood in the urine. This is urine sample and there's hemoglobin. That means there is hemolysis. Hemoglobin has come off. Then again, you'll stop the blood and you will give IV saline, furosemide. You will give. Right, and then you will handle DIC. Then still there is allergic reaction, bronchospasm, etc. Then you will have to give what? Oxygen, salbutamol, that they are giving here. Right, we are here, people, if you're not understanding. Here we are. Right, then there is still problem. You're suspecting bacterial contamination. Then you're giving antibiotics, etc. to that guy. Right, and then there's still dyspnea, etc. Then check if there is fluid overload. If the central venous pressure is raised, then you have to give furosemide. If central venous pressure is normal, then they're just taking, they're managing trolley. That is the transfusion-related acute lung injury. They're taking X-ray and they are giving ventilation, etc. Okay, basically everywhere they're saying stop the transfusion. Okay, and if there's only fever and urticaria, they're doing slow infusion. So hope you understood, people. In this video, we have looked at two things: donated blood, how they are collecting and how they are separating, etc., and how they are transfusing the blood and how they are handling the complications. So all this we have looked at in this video. Bye bye.